Hi, this is Xuan Gui. We're here at Social Health 2010, and I'm here joined by Dr. V, as he's commonly known on Twitter. Welcome, Dr. V.
Great to be here.
Dr. V just gave a really interesting unconference session on the role of the provider in social media, using social media in healthcare. So I'm going to ask, first of all, if you could just give a very brief summary of what you talked about and some of the discussion that happened there.
Well, we talked a little bit about the role of physicians in the social media space and whether physicians actually have an ethical obligation to participate in social media. I think things have changed really dramatically over the past several years. The shift of power has really gone from providers over to patients with the rise of the infosphere. And I think physicians have, to some degree, get lost in the shuffle. And I think that we do, as physicians, have an obligation to be participating in the conversation. If you look at the American Academy of Pediatrics, for example, has 60,000 members, and if you Google autism and vaccines, you'll see lots and lots of anti-vaccine propaganda being promoted. If each one of those American Academy of Pediatrics physicians blogged once a year, we would own those search engines. And so that's just one example about how physicians really should be involved in the social space.
Okay, and what do you think are some of the barriers that are preventing physicians from getting involved in social media?
Well, I think physicians by their nature are just concerned about the issue of transparency. I think what happens in the exam room between a doctor and a patient is really quite closed. There are a lot of barriers between doctors and patients that are being broken down. I think that translates to the online space. I think a lot of doctors are concerned about patients seeing what they're talking about and what they're doing. There are also the obvious legal concerns about liability and health privacy violations.
And where do you see this going in the future in terms of taking from your personal experience using social media in a conversational manner to where physicians can go, or what you hope to see happen in the future in this space?
Well, I think we're seeing the early adopters or early physician adopters in social media, I think, have really been using social media as a means of extending their own personal brand. The dialogue between providers and patients really has yet to happen in the social space for a variety of reasons, privacy, liability, et cetera. I think as things evolve, we're going to see doctors and patients conversing a little bit more. I think there's some issues with healthcare right now that we're confronting. You can't have doctors having conversations offline when it's hard to have conversations in the exam room. So I think that's probably where we're headed.
I think that's pretty much it. Thank you very much. It's really an honor to have you here, and really great to hear what you have to say as well.
Okay, great. Thank you.